of your program or your intervention. So you're always going to be doing some sort of preliminary testing of your program or your intervention before scaling up. So again, these are a very important aspect of either an intervention or a program that you're trying to do. So as we go through today, and you can put this in the chat or you can raise your hand and we can talk about it. But I'd like to know. I've given a similar talk before, and it's always nice to hear how many people have been doing pilot studies and then what your pilot studies have done. So if you want to throw those in the chat, that would be great, so I can get a sense of who's all here and what work they've been doing. So I'll monitor that chat as we move forward. And then if you care to, in the chat, or again, feel free to raise your hand, if you've had any sorts of problems with your pilot studies, and it could be any aspect of the pilot studies, put those in the chat as well, and we can discuss, and I can kind of pull from those examples as I go through some of the scalability issues and some of the measurement things that we'll do with our pilot studies. But that is one thing that I did want to highlight, is that the first issue that we've identified with pilot studies is that a lot of them end up having these scale-up issues. And the problem happens when we take a small-scale study and we think it's going really, really well. People like our program, they like our intervention, we're able to recruit, we're able to retain our participants, we're able to measure what we need to measure. But then when we go to scale it up, yay, we've got that nice large scale R01 funding, and we go to scale it up and we test the intervention, and for some reason, the effects of that intervention are just not replicated in a large scale study. So when I was at South Carolina, one of the first things that we wanted to do was understand, why do pilot studies have scale-up issues? And the first kind of hard science we'll look at is these things called risk of generalizability biases. So these were things that we identified that kind of influence that scale-up penalty or that drop in effect size. So, and this is what they are. So we've identified quite a few of these biases in pilot studies. And the crux of the issue happens when you have something present in the pilot study that isn't the same in your scaled up study. So for example, if we look at maybe implementation support bias right here, the second one down, if you have a lot of implementation support in your pilot study, and maybe you're only at one site or you're with a few participants, that's very feasible to do, because you can have all your study team out there helping to implement the intervention. You're providing a lot of support, and that's fantastic. But the problem is, when you go to a larger scale study, maybe you aren't able to provide that same level of implementation support. You don't have the correct number of staff, you're at too many sites, you're strung thin a little bit across these multiple sites. And so what happens is your implementation support does not look like it does in the pilot study. It decreases. And one of the things that can happen with that is the effect of your program or the effect of your intervention can decrease. And this can happen in a lot of different ways. So it's not just implementation support. There's target audience bias as well, intervention duration, setting bias. So for example, if you pilot your study in a really great supportive community and it works really well, and then you scale that up into different communities or different study sites, well, there's a lot of heterogeneity in those study sites and those settings. And so what works in one setting might not work in a scaled up setting. So to illustrate this, what we did, and I'll kind of walk through a couple of these figures because they're a bit confusing on the outset. But what we did is we tracked pilot studies, published pilot studies, and we tracked them with their full scale intervention. So we included studies in this brief meta-analysis that had a pilot study that had outcomes measured and effect sizes. And then we found that same pilot study when it had been scaled up and published. And we found a couple interesting things. So just as I was saying before, this implementation support, these are kind of some of the numbers behind it. So when we look at these green and red and blue boxes, the red box represents a set of studies, a pilot and a large-scale trial, where implementation support was only provided in the pilot study and then taken away in the large-scale study. And the red indicates this huge, what we call a voltage drop in the effects of that study when it gets scaled up. So again, you take away that implementation support, you have a hard time doing that in the scaled up version, you might see your effect of that program drop off. So it's a scaling penalty or voltage drop, as we call it. We saw the same thing when you change the setting. So if the setting is the same from a large scale study or from a pilot study to a large scale study, the green and the blue, these indicate, well, there's really not much of a change in your effect. That's great. But when you do change the setting, when the setting is not the same from your pilot to your large scale study, you do see this voltage drop again. And this led us down a really interesting path, these first two studies. We wanted to know what was going on in the pilot study behavioral intervention realm. And so we published a series of other studies, and if you'd like, you can check these out. And I can put citations in the chat if need be. But this led us down a path of what's going on with pilot studies and how do we improve them. And one of the studies that I'll highlight, which will bring us into the main topic that we'll discuss, is this study we published last year. When we were looking through all the pilot studies for our different reviews and meta-analyses, we realized that people were using a variety of resources to guide them for their pilot study, either whether it be the design, the implementation, the analysis, the reporting. And we were really interested in what people were using in the field. So in terms of the literature that people were using. And so we did this review of really recent behavioral focused preliminary intervention studies to identify what guidelines people were using, what checklists, what frameworks were out there, what recommendations they were relying on. And we wanted to see if that use influenced how they conducted and reported their pilot study. So the way we did this is we got a bunch of different behavioral focused preliminary studies, and we went through and we scrubbed all of their references. And then we went back even further and looked at the references that those references were citing to get an idea of what people were using in the field. So this is kind of where our data came from. And basically what we found was when you use the available literature to help you design your pilot study, you had higher odds of reporting things like retention rates, acceptability, compliance, costs, data collection feasibility, treatment fidelity. So all the things that we would like to see in a pilot study, these pilot studies were doing. You also had higher odds of mentioning feasibility in purpose statements, providing these things called progression criteria, which we'll talk about in a minute, framing feasibility as the primary outcome, which should be done in our pilot studies, and then mentioning feasibility in the conclusion as well. So we thought, okay, these people are using these resources, and that's fantastic. It's definitely improving the state of pilot studies in terms of behavioral interventions. But a big problem we found was that we found 162 of these guidelines, checklists, frameworks, and recommendations just for behavioral intervention pilot studies alone. And the problem with this, the sheer number of these guidelines, people were using them, but what we found that they had to do was kind of piece together different aspects of pilot studies from these different publications. So some publications may offer guidance on how to recruit and retain participants. Some may offer guidelines on how to report your pilot study when it's done. Some may focus more on the statistical analysis. So there wasn't really one end-all be-all resource that took all of these 162 publications and put them together in one form. And so the final deliverable of this NIH R01 that we were on was this consolidation of resources. And this is what we'll talk about mainly today is this paper that we just put out. It was just published a couple days ago, actually. I think today's the 9th. It was published on the 6th. So this is brand new, and it's the consolidated guidance for behavioral intervention pilot and feasibility studies. If you want to follow along, you can scan the QR code. I can also drop this DOI link in the chat as well, so you guys can have that. But that was the whole goal of this consolidated guidance, was to take those 162 publications, put them together into one resource, and really have something that would be useful in the field. So the way we did this is we started with our 162 publications, and we looked at everything that they were saying. And then what we did is we invited the authors of all 162 publications to take part in a Delphi study. And in the Delphi study, what we did is we sent them a link to the survey after I think we ended up having 495 authors that were invited. Not all took the survey, but we invited 495 authors of these studies, the first author, the corresponding author, and then the second author. And we said, hey, would you like to be a part of this Delphi process where we take all of your really great resources and we put them together into one? And the first thing we asked in this Delphi study was a very broad question. We sent them a survey and we asked, what are the most important considerations regarding either the design, the conduct, the analysis, or the reporting of pilot or feasibility intervention studies? And once we got their responses back, I think we left them 20 blank fields so they could fill out however many as they wanted. We performed this qualitative analysis on their responses. And as you can imagine, folks were coming from all different backgrounds, different fields, different expertise. And so we had a lot of important considerations. They ranged from using frameworks, from assessing recruitment, reporting, statistical analysis, pre-registration. So we had a lot of really good considerations, and our task was to kind of put them into something that made sense. So we came up with 6 overarching themes and 20 sub-themes based on all these qualitative responses here. And then we fed those themes back to the participants of the Delphi study. So we gave them the theme, we gave them a sub-theme, we gave them a basic definition, and we said, okay, if you were going to provide a recommendation, if you were writing a consolidated framework for behavioral pilot studies, how would you write that recommendation? What would your wording be, and what would you recommend? And then again, we did a qualitative analysis based on what they wrote for each of those themes. And then our job as the study team was to take all of their responses, put them together into something that made sense, and again, feed that back to them in round 3. So this is an example of what they would have seen in that last round of the Delphi process. This was one of the themes, statistical analysis. A sub-theme was sample size. We provided a basic definition for them, and then we fed them back their recommendations. We cleaned them up a little bit. We consolidated a few things together, and we asked, how much do you agree with the recommendations provided above on a scale from 0 to 10? And then we also had some free text where they could put in other thoughts as well. So that was the basic process of the Delphi study that we did. And so I'm going to present a few of these themes and sub-themes to us, and then I'll point you toward where you can look at all of them together. And then we can have time for some questions and hopefully answers as well. So here were the 6 themes. We talked a lot about intervention design, study design, the conduct of the trial, the implementation of the intervention, the statistical analysis, and the reporting. So based on that Delphi study and based on what everyone was reporting in those 162 publications, these were our 6 overarching themes for what we should consider when we're designing and implementing a pilot intervention. So the design of the intervention, which is separate from the design of the study. So the intervention would be, the types of things that you're doing to maybe change behavior or change your outcome. The study design is separate. So are you doing like a randomized control trial? Are you doing a step wedge design? Do you have control groups? Those types of things. We have the conduct of the trial, so how you recruit, how you retain, how do you make your participants like the intervention? The implementation of the intervention itself, so things like fidelity, how you analyze all your data once you've captured it, and then how do you go about reporting it? So those were our overarching themes. And then each one contained different sub-themes. So for example, for intervention design, we had these 5 different sub-themes: adaptations and tailoring, site selection and context, community partner engagement and co-production, theory usage, and then how do you craft well-defined problems and aims. For study design, we had some recommendations on iteration and intervention refinement, progression criteria, randomization and control groups, how you handle that in your study design, and then again, how you scale up your study. For the conduct of the trial, how we measure and collect data, how do we recruit, and how do we retain. For the implementation of the intervention, we provide recommendations on acceptability, how do you measure it, how do you assess it, the fidelity of the intervention, and then how do you go about assessing costs and resources, and then how do you go about projecting that into the future when you scale up your study. For the analysis, we had 2 main sub-themes. These were sample size, what's the perfect sample size for a pilot study, and then how do you assess the preliminary impact of your outcomes. So whether that be, I'm a physical activity researcher, so for me, it would be measuring the preliminary impact of my intervention on changing physical activity. But it could be any outcome that you have in mind. And then finally, how do you report? So do you pre-register? Do you register a protocol? Do you publish that protocol? How do you label your study? Is it a feasibility study? Is it a pilot study? Is it a proof of concept? And then how do you go about using frameworks and guidelines, and what are the best ones to use for certain aspects of pilot studies? So because we have so many of these considerations, I am going to go into detail on a few, but I just wanted to give you an idea of how these are set up in the paper and kind of how you can use the consolidated guidelines here. So we have our themes, and then we have our different sub-themes. And then in the actual paper, if you have that pulled up, or if you pull it up later, you'll see that within each theme and each sub-theme, there's a definition of what that sub-theme is, and then we have the actual practical considerations for you to think about when you're designing your pilot or feasibility study. So again, I'm just going to hit on a few of these. We'll talk about one in intervention design, a couple in study design, and then one of each in the conduct of the trial, implementation, and statistical analysis. So one that I thought would be particularly important to discuss, especially with you all, is community partner engagement and co-production. So the way we defined community partner engagement and co-production was a very simple definition, but it's just the use of either individual communities, service providers, other community partnerships that might aid in the development and the implementation of an intervention. And what we recommend is that whenever possible, community partner engagement and co-production should be a key piece of your pilot and feasibility study. And one thing that I'd like to stress when we talk about co-design, sometimes people get hung up on the timing. When should we bring community partners in? When should we allow the co-production process to take place? And really, it should be through all stages of the pilot and feasibility study. We should involve community partners in the very beginning stages of our pilot study, and they should really have a say and ownership, part ownership of the research that you are doing, because that's what's important when we design these programs, is that we're making a positive change in the community. And so we want to make sure that those community partners are engaged throughout the entire process. I did want to provide an example. This is one of the co-production frameworks that I use in some of the grants that I write. I've adapted it for different things, but this is a really great one from Hawkins. I believe it was published in 2017, but this is a nice co-production framework where it kind of walks you through, the different steps of how you start community partner engagement and co-production, what that co-production process looks like, and then how do you involve those community partners when you're testing the intervention as well. So if you are interested in more about co-production, please check out that article. It provides a really nice framework for this co-production. And it's also cited in our consolidated paper. The next thing I want to discuss is progression criteria. Now, not everyone might not be familiar with progression criteria. We provide a lot of recommendations on progression criteria and what they are, but essentially what they are a set of a priori benchmarks that you set before you do your pilot study. And the way it works, some people call them like a go, no-go system or a stoplight system where you have like a red, amber, green scale. But it's a way to measure, it's like a bellwether for your pilot study. So one piece of progression criteria, one of your progression criteria might be, we want to recruit at least 80% of our target sample. So if I have 100 participants eligible for my intervention, I want to be able to recruit 80 participants. And if I recruit 80 participants, it's green. That means I can progress to the next stage. I can scale up my study. If it's yellow, maybe I only recruited, 70, 75 participants. If it's red, maybe I only recruited 50 participants or 50%. So that would tell me that when I go to scale up, I either need to rethink my recruitment strategy, or I need to maybe pilot this again to see if I can recruit my study population in a better way. So it's not just recruitment, it's participant acceptability as well. So we want to make sure, let's say our progression criteria is 95% of our participants found my intervention acceptable. They enjoyed it. They wanted to come to the program, things like that. And if it's yellow, maybe only 70% enjoyed it. And then if my progression criteria get in the red, maybe only half my participants enjoyed it. And so I need to rethink how I deliver this intervention, because if folks don't like the intervention in the pilot study, when you scale it up, you'll have a really hard time with things like retention and adherence to your intervention. The way that I represent this, I've written a couple different pilot study grants, and I typically like to include a table, like a table shell for my progression criteria. So this is one way that I've done it in the past. You don't have to put specific numbers on this because, again, you don't know exactly the numbers that you're going to get in terms of recruitment and retention and other things like that. But you can put percentages. So this is how I've framed it in the past with some of my grants, where I outline my different progression criteria, and you can have different types of feasibility outcomes. It doesn't have to just be recruitment and retention and acceptability. It could be anything that you want. And then you outline kind of your, this red, amber, green stoplight system for progression criteria. And one of the main points about progression criteria is that just because you get in that amber or that yellow or that red, it doesn't necessarily mean you have to stop the presses and go back and repilot your study. It just means that you need to be really careful about what you do in the scaled up version. And you should probably think about changing your strategy with whatever outcome it is if you're in that yellow or red. So it just gives a really nice, I guess you could think of it as a really nice fallback, and again, a way to kind of check to see where you are throughout the process of your pilot study. And if you start to veer toward that yellow or red, you should think about changing some things. So that's what progression criteria are. They're fairly new in terms of reporting them, but they're a very nice tool to use in your pilot studies. So for scale up, this was one of the sub recommendations here in study design. For scale up, we define this simply as delivering your intervention, your pilot intervention, in progressively larger studies. So one thing that we always want to keep in mind is that we should never do a pilot study just to do a pilot study. We should always be thinking about, what is our pilot study going to look like when we scale it up for future testing? So if you have some preliminary funding, you get a small grant, that is fantastic. Pilot your study, but always be thinking about what that study is going to look like and how you're going to use that pilot information for the scaled up version. So we should never pilot something just because we have the money to do it and we don't feel like it's going to ever come to anything. We should always have the intent of future testing for a larger scale trial. And then when we talk about scale up, we kind of went through different things to avoid in your pilot study, and this goes back to those generalizability biases. So think about what your scaled up study is going to look like, and if you don't think that you'll be able to recreate it at the same level from your pilot to large scale trial, you should think about doing something differently. It's very easy and it's very tempting, for example, to provide a lot of implementation support during your pilot study because you have the resources and you want a lot of the times these are passion projects, you want your project to succeed in such a way, again, that it's very tempting to provide a lot of support during the piloting phase. But I would encourage you all to think about how that will scale. And if you don't think that it's realistic to provide the same level of support in your pilot study to your large scale trial, think about how you can scale that back a little bit. It is difficult. I understand. I've been there before, but these are just things that we need to think about when we do our pilot studies. How do we scale up, and does it look the same? Because remember, these can have really big issues when it comes to the effect of our intervention. If we take away implementation support, or if we change our target audience or our setting, our effect sizes can really take a hit in that large scale trial, which isn't something we want. For recruitment, recruitment is always one of those things that's a sticking point for pilot studies. And we provide a lot of recommendations for at least how to contextualize your recruitment processes. So, recruitment rate, it's the proportion of eligible participants or even settings or clusters or sites who are enrolled at baseline, right? So we should be thinking about a couple things. One, we should be thinking about what's our eligible total sample. If we can get that number, that's great. That gives us more information. And then how many out of that eligible sample are we able to recruit for our study? That gives us an idea of, are people going to sign up for our study? Are people going to attend our sessions? Are people interested in the things that we're putting out? So it's always nice to have a general idea of how many people are eligible for recruitment and then how many people you actually got to be a part of your study. The latter is hard to get sometimes, especially when you're dealing with multiple sites, or if it's a community-based intervention where you don't know how many people are out there. But there are certain ways to measure that. So I encourage you to try to get that number if you can, because that gives you an idea. Again, going back to your progression criteria, how many people are interested in your intervention. And then in terms of the information, other information that you should collect, you should always be keeping track of when you start your recruitment and when it ends, because you want to have that timeline when you scale up your study. If it takes 6 months to recruit 100 participants, it might take 5 times longer to recruit 1,000 participants in your large scale study or whatever it is. So always have that timeline in mind. And another important thing that I think some people forget about, or they don't maybe pay enough attention to, is collecting data on the reasons for non-recruitment and non-consent. I know that seems a little counterintuitive, because if people don't want to be a part of your intervention, how do you think they're going to fill out a follow-up survey on why they didn't want to be a part of it? But it's always good to ask, because that gives you an idea again on, it's not just, oh, we couldn't recruit, but now we can answer the question of why weren't we able to recruit? And I think people are generally pretty honest with you. We've asked these questions before in other programs and interventions, and people will tell you, it seemed like it was too much of a burden, or I had to drive to a site and I couldn't do it because of transportation or whatever it is. So you can get some really good information on just asking a simple follow-up question. Why didn't you want to participate? So I encourage you all to do that. So fidelity, this is part of the implementation of the intervention. And one of the things that we found in our reviews of pilot studies was that not a lot of people were measuring fidelity, or if they were measuring it, not a lot of people were reporting on it. So fidelity is just the degree to which an intervention is delivered as intended, and it's also a measure of the quality of that delivery. You can do this in several ways. You can measure fidelity in a lot of different ways. If it's a manualized intervention, you can track that manualized intervention to make sure that your deliverers are delivering it appropriately. You can do direct observations. You can do daily surveys. Did you deliver this piece of the intervention today? Did attendees, hop onto your Zoom session or whatever it is? Did they go to the site? So all those things can be measured, and I encourage you all to measure those. And then when you go to report your pilot study, report out those fidelity metrics because it's useful for others too who are doing similar interventions. The last one that I will mention before we open up for questions and answers is preliminary impact. Now, this was a really contentious topic for a lot of people. Because if you think about a pilot study, your pilot study may only include 30, maybe 50 people, or maybe it's only at one site. And you're not really powered to assess true effects of an intervention on your outcome. But when you go to write your large scale grant, people want to see some sort of an effect size. So it was balancing that. Really, if you think about it statistically, it's not appropriate to say this pilot study had an effect on this outcome because you're not powered to say that in most cases. So how do you deal with preliminary impact? So we came up with a lot of different recommendations that people can use to frame preliminary impact, and how do you test for that when maybe you shouldn't be. So the first thing is whenever you're dealing with a pilot study, your outcome, your behavioral outcome, whether it be a health outcome or something else, those should always be secondary to your feasibility outcomes. Whenever you're framing a pilot study, you should always have your feasibility outcomes as the primary outcomes and your behavioral outcomes as secondary. And so that's kind of the first recommendations that we give. And the whole p-value versus statistical testing thing, the way we landed on that was, in the pilot study, we shouldn't really be in the job of interpreting p-values as conclusive evidence for a pilot study's impact. But what we can do is we can look at 95% confidence intervals around those effect sizes and see if things are shifting. And so a lot of the times, the way I've framed this is, there's evidence of a shift, right? Or we can't really assess the impact of the study, but we can demonstrate that the intervention is moving an outcome in an appropriate direction, and of course is not causing harm to the participant. And I know that's difficult too, because when we go to write grants, again, people really like seeing those p-values and effect sizes, but we should really be reporting those feasibility outcomes first and preliminary impact second. So I went through a couple of these considerations. There are a ton more that, again, are published here in this paper if you want more details on them. Again, you can get the full text there if you want it. I can also put it in the chat for folks who are interested. And I'll leave you just with a few parting thoughts. The first is, I think that people should use the considerations that we put together as a starting point. And one thing that I really wanted to stress is that we relied on 162 other publications to put, these consolidated recommendations together. And if you do access that study, a really helpful tool, which may be even more helpful than the recommendations we put out themselves, is we crosswalked every single publication, all 162, with our 20 sub-themes. So this is the first page of this crosswalk. I was only able to fit one page, but I think there's like 6 or 7. But you'll see a list of all 162 publications that we used for the recommendations that we provide. And then those are crosswalked with all the different aspects of pilot studies, those 20 sub-themes. And it's a really useful tool to dive deeper into a very specific question that you might have. So if you're struggling with putting together progression criteria, for example, you can go over to this progression criteria column, and we've identified every single study or publication that provide recommendations or frameworks for, let's say, progression criteria. So you can look at this Abbott 2014 article or the Ashburner article or the Avery article, and the list continues. And so that's a really nice resource that people can use. That's not just our study, but it's everyone that contributed to the recommendations. So I feel like that's a really nice place to start as well. Once you have a specific question in mind, go to the crosswalk and, start looking at all those other resources that we provided and cited. We've done the work for you. We've looked to see what people are talking about. So use this tool as a way to identify further publications that you might want to use. And the final two thoughts are, it takes a long time to get preliminary evidence. It takes typically about 10 years from, if you're getting a PhD or whatever your terminal degree is, it takes about 10 years to get that large scale funding. So be patient. And like we always say in the pilot study field, please design with the end in mind, because that'll help you have a successful scaled up intervention or program. Thank you very much for attending this webinar. This was a great talk. I really enjoyed giving it to you all, and I hope that you have further questions for me so we can discuss.
Thanks, Dr. Pfledderer. That was a really great presentation. I haven't seen any questions come in specifically on the chat, but feel free to open up your mic if you do have any questions.
I have one quick question. I was wondering, do you consider biases in research being inevitable, especially like in the design of pilot studies?
Can you repeat that question one more time? I didn't quite get the first part.
Oh, do you consider like biases in research being inevitable, especially in the process, like in the design of pilot studies?
Yeah, that's a good question. So, the question is, when we talk about these risk of generalizability biases, are some of these things just inevitable? You can't avoid, dealing with implementation support. And that was one of the things that we discussed when we were writing up these studies was, I think in every pilot study, you do have a certain level of support, or there is a certain shift in setting, who you're delivering the intervention to. That's just a part of scaling up your study. And so the answer to your question is yes. I think a lot of these biases are inevitable, but the question that we should have in our mind is, how do we reduce those biases as much as possible when we design our intervention? Yes, we may have more implementation support. Our study site is going to look different from our pilot to our large scale trial, but how can we do our best to limit that bias when we go to scale up?
Okay, I guess a follow-up question would be like kind of like, what measures should we take to prevent biases? I know you had listed some in that article, but like what are some other measures that we could take, especially when we design pilot studies?
Yeah, so it goes back to that quote I gave at the very end, which is to design with the end in mind, right? Whenever we're doing a pilot study, we should always have an idea of what that scaled up version is going to be. We can't predict the future, of course. But when we're making decisions about how we deliver our intervention or the sites that we're selecting and who we're working with, we really want to think about, is this going to be feasible when we scale up? And when you're in your meetings, when you're in your intervention development meetings, that should always be a question that someone says, is this going to be feasible when it's in a larger trial? And if the answer is no, your study team should really think about how you change that to make sure that people are saying yes when the question is this going to be feasible when we scale up, right?
Okay, thank you.
Yeah.
Any additional questions?
I have a lot of questions. I don't know if that's okay if I just go ahead and ask. I want to give
Go
a
ahead.
chance to
Yeah.
others to ask as well. I guess another question will be, should pilot study be designed to fail or to succeed? Like, because a lot of times when we design pilot studies is we don't really have like a great we don't like you mentioned, we can't predict the future. So when we design them, should we like design them to succeed always, even though that's not the case?
Well, I tend to be an optimist, so whenever I design a pilot study, I hope that I'm designing something that will succeed, but but we have to think about how we frame that success, right? So with a pilot study, your success is really based on those feasibility metrics that I talked about. Can you recruit? Can you retain? Do participants like your intervention or whatever program it is? Is it cost effective? Is it delivered with fidelity? Things like that. So that's really your idea of success in a pilot study. When you go to scale it up, your idea of success now has two things. It's, can we do this at a scaled up level? But then also, is it going to effectively change our behavior of interest or our outcome of interest? Yes, we want to make sure that we're assessing that in the pilot study, but again, it's hard to do that because of the sample size and things like that. So we can kind of take a peek at that and we can say, oh well, these health behaviors are moving in the right direction. But now for the successful scale up, let's make sure we can recruit, we can retain people like the intervention, and it's also effective at behavior change or any of our other outcomes that we're interested in. So success is defined differently at different scales.
Great, thank you. I saw that now I've noticed observe a lot now that what you call that community workers are implemented in research design, especially at the pilot phase, which I think is important to like get their opinion and get their feedbacks and all. So I'm wondering, like, kind of like, what role do community workers like, what role do they play when it comes to like authorship whenever you are working on manuscripts?
That's a great question. I think if you were to ask someone that 20 years ago, they would say, no, we're not going to have our community partners as co-authors. It's not important to them, and they don't gain anything. But that's I think completely wrong. And more often than not, what I'm seeing now, especially with pilot studies and even the large scale studies, is that those key community members are often involved in authorship. And when I'm doing these types of studies, I always include those key members of the community on as authors. For me, it costs me nothing to put authors on the study, especially if they're a really key part of the success of that pilot study. So I always invite community partners and people that I'm working with that are outside of your traditional academia on as authors. And it's also a really nice deliverable for them. And one of the other things that I'll mention too is the publication and the intervention, that's a really nice deliverable, of course. But one thing that I always like to do too, as a follow-up, is if I'm ever working with community partners, I always ask if they want for someone or myself to present on the program or the intervention to the larger community or maybe to an advisory board. So you always have to think about, yes, we delivered the intervention to you or with you, but what else can we do? How can we give back? Because your community partners are essential, and I'm sure you all know that here. And so you want to make sure that you're treating them right, but two, that you're giving them their credit where credit is due. So I think authorship is a great way. I think it's a small gesture, but it's a great way to include them on that. And some community partners, so I've worked with some community partners in certain uh, cultural backgrounds where their community or they have like an advisory board, like I've said, where it's actually you have to send the draft of the publication to the advisory board. They have to review it. They have to make sure it's okay to publish. before you send it back. So that's another example of kind of, including people where send them drafts of the publication, make sure everything looks good, make sure you're representing that community the way that they want to be represented before you send it off to try to get published somewhere.
Great. Thank you so much.
Yeah.
All right, I think we have a little bit of time for one more question. If there's anyone else? Going once? Going twice? Okay. Well, thank you all for being here today. Thank you, Dr. Pfledderer, for your presentation. It was really great. It is being recorded, so hopefully we can get this up on our website. Yeah, so I hope you all have a great day, and please feel free to email us if you have any questions. Again, if you do need CHES or MCHES credits, we'll be emailing that out to you.
Yeah, thanks everyone for joining. I put the link to the study that I presented here in the chat. I think it went through, and then I believe I had my email up, but feel free to look me up if you have questions about anything. I'm happy to hop on another video call with you to answer specific questions. So again, thanks for everyone who was here today. I had fun.
Yeah, thank you. We can also make sure to send that link out with any follow-up communication. Thank y'all. Have a good day.